Hi, I am Anant Kamat, consultant neurosurgeon specializing in complex spine. I would like to bring a few videos explaining common spinal conditions, their symptoms, and how these conditions can be managed at home. We'll also see when to seek medical advice, what are the investigations, and the treatment options, including surgical option, that may be available for you. In this particular video, we'll talk about sciatica. We'll cover what it means, what are the symptoms, how to manage the symptoms at home, when to see a doctor, what investigations are performed to diagnose this condition, and also to treatment options, and most important, when to seek urgent medical help. Sciatica is pain shooting down the leg. It is usually due to nerve getting nipped in the lower spine. It may begin as back pain for a few days or a few weeks, and then the pain may start shooting down the leg. It is not unusual that at this stage for the back pain to improve. The pain is usually in the distribution of the nerve and may be associated with pins and needles, and sometimes there can be numbness or weakness along with the pain. This model shows the lower spine. This is the front of the spine. This is the back of the spine. This is the top of the spine, and this is the bottom of the spine. These are the bones of the lower spine. They are called the lumbar bones. They are numbered and they are 5 number. This is L1, this is L2, this is L3, this is L4, and this is L5. While this bone is the sacrum. These are the discs between the bone, and they are also named according to the bones it is adjoining to. For example, this is L5 S1 disc, while this disc, which is between L4 and L5, is the L45 disc. Similarly, this is L34, L23, and L12 discs. The disc is made up of an outer annulus, which is a tough fibrous layer, and an inner nucleus, which is a jelly-like material. The nerves pass through the spinal canal, which is encased by the bony spine. These are the foramina through which the nerves exit the spinal canal to provide neural supply to the legs. Wear and tear changes in the spine can lead to tear in the outer annulus, and the jelly-like nucleus of the disc can then protrude or extrude through the tear. And this herniated disc can potentially press on nerve root. The irritation of the nerve can result in pain radiating down the leg. Usually this pain is sharp shooting type of pain. Depending on the distribution of pain, we can clinically predict which nerve is giving the symptoms. In addition to pain, pressure on nerve may result in numbness in the distribution of the nerve, and also sometimes weakness in the group of muscles supplied by that nerve. Sitting, bending, cuffing can make this leg pain worse, while lying down with hips and knee flexed or bent can improve the leg pain. The natural history of disc prolapse is usually to improve with time. It might take a few weeks to few months, but there is a very good chance that symptoms will improve and sometimes completely resolve. Hence, the main aim is to keep the pain under control and avoid activities which can worsen the condition. Prolonged bed rest is not required. Painkillers to keep the pain under control and a good posture can get you through this period. Avoid further stress on disc by avoiding bending and lifting. Avoid sitting for prolonged period of time. If you do have to sit, sit with a pillow behind your back, which will allow you to sit in a better posture. If the pain does not subside at 6 weeks and remains significant in spite of full conservative management, I would recommend getting an MRI. MRI is a non-invasive scan which uses a strong magnet. It shows soft tissue very well. It can give definitive diagnosis of the origin of pain and confirm a disc prolapse. It will also help to rule out sinister cause of the symptoms. Though we normally wait for 6 weeks for MRI for back and leg pain, MRI may be performed earlier if the pain is excruciating and not coming under control with usual non-operative methods, and we think that an intervention may be necessary. MRI should be done earlier if there is any suspicion of underlying sinister cause. For example, if there is any suspicion of malignancy or spinal infection or trauma, that would be a strong indication for an early or urgent MRI. Also, if there is any progressive weakness, progressive numbness in legs, numbness in back passage area, or any bladder, bowel, or sexual dysfunction, urgent medical attention by going to the local A&E for assessment, and if needed, urgent MRI may be required. The natural history of disc prolapse is to improve with time. Hence, the initial treatment is usually conservative with painkillers and physiotherapy. Bed rest is usually not necessary, and prolonged bed rest is not advocated. However, maintaining good posture while sitting, standing, mobilizing is important. I would advocate avoiding bending and lifting till the pain subsides significantly. If the pain is significant and not controlled by usual methods, then hospital admission may be necessary for better control of pain. In that situation, an MRI is usually performed. This may indicate the nerve responsible for the leg pain. The treating doctor may offer a nerve block to complement other pain management treatments. We'll talk about nerve block in greater detail in a separate video. Lumbar discectomy is a very common operation that we perform to remove the prolapsed disc to relieve the pressure on the nerve. This usually has very good results. The surgery is indicated for significant leg pain which has failed conservative management. Earlier surgery may be indicated in patient who has leg pain which is not controlled by non-operative means and is significant enough to affect day-to-day activities. Every surgery has potential risks and limitations. It is important to understand these limitations and risks when one is considering surgery. The cauda equina syndrome is a group of symptoms which arise when a large disc or a significant pathology completely obliterates the spinal canal, compromising the lumbosacral nerves. This can damage nerves controlling bowel, bladder, and sexual function. This can be significantly disabling to the patient, and hence this condition is a neurosurgical emergency needing urgent surgical intervention. We'll talk about this condition in a separate video. I hope this video was useful. If there are any questions, please do not hesitate to ask them. We'll try to answer them in subsequent videos.